This is Dr. Saima Hirji. Today we are going to discuss is one of the additional lecture on the bonding and bracket placement, and we're going to discuss about smile arc protection, which is very important. While you're putting the braces, you have to make sure that we not create any flat smile. The smile created, it's very much impacted by how we place bracket on the teeth, especially in the upper anterior section from canine to canine. So this is a concept is basically more get popular when the Damon braces have came out in the market, and they start training dentists, and they introducing some of the concepts which is different from the traditional orthodontics, and like traditional placement of the brackets we have discussed in the previous lectures. What is the ideal position, what is told by Alexander, what is told by Roth, what is proposed by MBT, what is proposed by other philosophers in the orthodontics. So when the Damon appliance came, they came with their own technique in which it has been advised that we have to place brackets in a position that we take the best advantage of the bracket prescription, which is a self-ligating bracket and Damon braces. We all know that Damon braces are different from the traditional brackets. So Damon braces have a more play because there is a slot and there is no ligature. So there is a more play between the arch wire and a bracket slot. Because of the more play, there is a chances that alignment would be very good, but finishing torque control would be very difficult. But by placing the bracket in a right way, in a way proposed like smile arc protection, we not only protecting the smile arc, but also we are incorporating the biomechanics that we activate the early approach of torque correction from the very beginning of the appliance. So how it happened and how it works, let's discuss in detail. The concept of smile arc protection came with the Damon braces. We all know that with Damon braces, it's more proposed for having a full smile. Traditionally, it is recommended to have a non-extraction treatment with a full smile and a broad smile, so that the buccal corridor are less visible. For many orthodontists, the combination of the full enamel display of upper anterior teeth with 1 to 1.5 millimeter of the gingival display is considered to be aesthetically pleasant. So in Damon appliance, we try to place the bracket in a position that we get full enamel and a gingival display of around, if you can see, around 1 millimeter to 1.5 millimeter. So it is also called as a curved smile line. The smile line follow the curve of the lower lip. So when we ask patient to smile, it's not a flat smile, it is a curved smile which follow the lower lip. So how you create a curved smile that follow the lower lip and there is no buccal corridor displayed with the help of a particular type of bracket placement. Now, by putting the bracket placement in a way advised for smile arc protection, also give a benefit of 3D tooth control positioning, which ends in superior predictable and aesthetic result during entire orthodontic treatment, and of course after debonding. With increase in the prevalence of the non-extraction treatment, early three-dimensional control of the upper anterior tooth position has become paramount in preventing incisor flaring, which is the torque control is maintained, and flattening of the smile curve, commonly associated with a crowding relief. So whenever we try to correct the crowding, we actually broaden the smile. But when you broaden the smile in the anterior section, it will flatten the curve of the smile. Now in Damon braces, if you see the arch form, I will show you later on, it is very narrow in the front and it is broad from the back. By having a specific arch form and a specific placement of the bracket positioning, we actually have a 3D control of the tooth positioning. We also control the incisor flaring and flattening of smile arc. So let's discuss about how to place the bracket so that we get the curved smile with the 3D control of incisor positioning. So in concept, you can see in these pictures that upper incisor brackets are generally placed more gingival than compared to the canines. Okay? And the lower posterior brackets are placed somewhat more gingivally, so they will not come into the occlusion. And the lower anterior brackets are placed somewhat incisal, so they can help in correction of deep bite. So what are the steps exactly we have to do it? So we have to remember the concept that as compared to traditional placement of the bracket, where we say that straight wire appliance says that bracket, Alexander says that bracket should be placed in the center of the tooth, in every tooth, okay? They say that by putting and using that type of bonding technique, we actually not able to create the smile arc and we not take the benefit of the Damon appliance. So they changed the concept and now they are not advising us to put the bracket in the center of each tooth. They have said that in the anterior upper section, the upper incisors are the most gingival, and then comes to canine, and then a little bit lower is a lateral incisor. And in the posterior teeth, we say that it is very much gingivally positioned so that it not come into the occlusion. And in the anterior section, it's placed incisally to correct the deep bite. So what are the steps for smile arc protection bonding technique? Number one, we have to recontour the teeth. If there is any mammalion, there is any fracture edge, either we restore it or we have to recontour it so that it look very clean and nice. And the canines, if they are very sharp, we have to recontour it so that we don't have any finishing problem of overhanging cusp. Okay. So first of all, we have to do recontouring of canines and lateral incisors. After that, we have to place the bracket first of all in the canine. So the position of the canine bracket is advised that incisal edge of the canine bracket wings are positioned gingival to the mesiodistal contact line. So this is the position of the canine bracket. The central incisor brackets now being placed, which is approximately 1.5 millimeter gingival from the incisor edge of the canine bracket. And finally, the lateral incisors brackets are positioned between 0.5 to 1 millimeter more incisally compared to the central incisors. So if you see from the side view that the most gingival placement is of incisors, then the canines, and then there is incisor. That's how you can see it. This way we create a positive smile arc protection. Now what is a disadvantage? So if you see from the way, you will see that you're creating actually a reverse curve of SP in the wire like that. But actually it's not reverse curve, it's in the way that when the wire becomes straight, you have a very good smile arc which follow your lower lip. Now, what are the side effects of such type of the bracket placement? Number one is upper incisor brackets are very close to the gingival margins. Okay, because of that, it is commonly seen that gingival swellings around the papilla region. To avoid that, we need to make sure that very good oral hygiene maintenance is required, and there should be no glue around the bracket so that the hygiene maintenance is very easy for the patient. So by placing bracket in this technique, in this type of this way, what we actually achieving it? We actually achieving that we activating early torque control. So this technique is comprised of a progressive case management strategy that complement smile arc protection bracket positioning for early 3D control. The bite blocks are always advised because the lower incisors, we have said that we have to put it incisally. So if the patient having a deep bite and you putting the lower incisor bracket more incisally, there is a chances of they come out fast. So we have to put a bite turbo, okay, which is anterior bite planes. We have to place it, and we advise immediate light short elastics from the very start of the treatment so that we flatten the curve of SP from very start in the lower arch. In patient with a deep bite, this technique helps to erupt the lower molars and extrude the upper anteriors as it moves them slightly clockwise. So you can see that the teeth are moving. The deep bite is correcting very in the very first visit because we have put the bite turbo, anterior bite plans, and we started with a short elastic which extrude the lowers and correct the deep bite in the early treatment stage. Protecting and enhancing the smile arcs. There are many factors that can make it more difficult to protect the existing smile arc or enhance inadequate smile arc during the treatment. So these are the conditions or patient conditions. If they are present, it means that it is very crucial that we have to place the bracket in such situation. We have to place the bracket as advised so that we can protect the smile arc. So in the normal cases where these situations are not there, smile arc creation is very easy. But if you can see these signs in the patients, it means you have to be very particular because these are the challenges which make the smile arc creation more difficult. So what are these 6 challenges which we can see in our patients? Number 1, inappropriate conventional bracket positioning, which typically reduce or flatten the smile arc during leveling. So if you put the bracket in the middle of the tooth and you put a Damon appliance with this philosophy, you will see you end up in flattening the smile arc. Okay, so any patients with have conventional bracket positioning, we have to reborn that patient brackets. The relative steepness and flatness of the occlusal plane. The flatter the plane, the more difficult it is to manage the smile arc aesthetically. Okay, incisor proclination. If the incisor proclination is already present before we start the treatment, creating the smile arc is very challenging in such cases. A broad anterior arch form. This is also another case in which the excessive intercanine span tend to flatten the smile arc. So we have to work with the arch form in a way that the broad anterior arch form is converted into a narrow anterior arch form using a Damon wire. Steep upper canine tips and inappropriate canine bracket position in relation to the incisors. For that, we know that we have to first recontour it so that the tips of the canines are not very steep and pointed. Otherwise, we will not able to create the smile arc the way we want it. Irregular shape and size disproportion among the incisor and canine. So if there is any irregularities in the size or shapes of the anterior teeth, first it need to be restored so that the final result is very good. This is one of the case. We have taken the pictures from the article, and you can see it is a retreatment case. So patient have a little bit of relapse, is a pre-treatment picture if you can see it, and a very flat smile arc, okay, which patient doesn't like the smile the way is it. So the brackets are bonding with the smile arc protection positioning, and progressive case management strategy includes inverted upper anterior bracket, posterior occlusal guide, which is bite turbos, and immediate light and short class 3 elastics are advised. And this is on the other side you can see the post-treatment pictures. After 15 months of the treatment, patient get a desirable aesthetic result, what he wants. If you compare the pre-treatment and post-treatment picture, you can see improvement in the smile arc. The cant of the upper occlusal plane is improved. The incisor gingival display arch formed with a proper white and pink aesthetic proportion. So it means that you can see a nice gingival display of 1.1 or 1.5 millimeter, and there was no gingival display in the earlier. The smile arc protection is there. If you see the pre-treatment, the lower lip was not following the smile line, but now the lower lip is following the smile. So the patient achieved what the patient was looking for with the help of bracket positioning and Damon appliance. Now, effects of the bracket positioning on the wire plane. So as you can see in this picture that there is a traditional bracket positioning in the diagram number A. In diagram number B, if you see the slot at the facial axis point, okay, and in diagram C there is slot at a smile arc positioning point, which is more gingivally, okay. If a full enamel display with 1 to 1.5 millimeter of the gingival display is required, like full enamel and plus the gums visibility of 1 to 1.5 millimeter is needed, it gives us a most aesthetically pleasing appliance and the youthful appearance of the smile. It is important that to appreciate the negative effect of leveling, especially upper incisor intrusion in deep bite case on the smile arc. So if you see a patient who has a deep bite and you put the bracket more gingivally, what you will see? The deep bite will be, during the treatment, the incisor will intrude more and correcting deep bite would be more challenging. But with a SAP bracket positioning, we still do the same thing, but how we can address the correction of the deep bite is we use a TADS or the utility arch for intrusion. Rather than relying on the bracket positioning, we use the TADS or the utility arch for deep bite correction. So that if we are correcting the deep bite, we're not flattening the smile, okay? Whenever is needed, we also put a mini screw in the lower anterior section as well. So we intrude both the upper anteriors and the lower anteriors. So bracket positioning would be the same as advised by bracket smile arcs protection technique, which is more gingivally. But deep bite is corrected by using the skeletal anchorage and the utility arches. The maxillary arch wire plane is then parallel to upper lip. The incisor edges of the upper anterior teeth will follow the lower lip with the treatment. The divergence of the wire from the occlusal cusp tip or the incisal edges increase from posterior to anterior. You can see the diversion here. Okay. So the smile arc protection bracket positioning actually making the maxillary arch wire plane parallel to the upper lip and incisor edges of the upper anterior teeth will follow lower lip during the treatment. To develop the pleasing smile arch display and positively affect upper occlusal plane cant, maxillary anterior teeth must be positioned more gingival for smile arc protection than in traditional technique. Divergence of the plane from the cusp tip or incisor edges increase from posterior to anteriorly. So either the patient having a deep bite or doesn't have a deep bite, the bracket positioning in the upper anterior section would be with the same technique. Okay. When the occlusion is disarticulated with the bite turbo and the mechanics are supported by the very light short elastic from the first appointment, uprighting of the procline teeth will begin even on the light round wire. When additional retroclination of the incisors are desired, the mechanics can further support it by inverting the upper anterior bracket to 180 degree, producing an active lingual crown torque in the slot with the dimensional arch wire. So one of the complaints or shortcoming of the self-ligating bracket is poor torque expressions. Okay. But by using the smile arc bracket positioning, we actually cure that side effect of the self-ligating bracket. Research have shown that actual clinical play in self-ligating brackets can be as much as 2 or 2.5 times more than predicted by the mathematical model, making reliable expression of the third order movement problematic. Since the most effective application of the force is closer to the center of the resistance, how? Because we are placing the brackets more gingivally. We are going more close to the center of the resistance of the upper incisor. The bracket positioning also has an important effect on the torque. The smile arc protection bracket positioning moves the wire plane closer to the center of resistance of the tooth, providing more torque control. With SAP bracket positioning, the effective prescription of the bracket is reduced relative to the occlusal plane so that the torque movement of uprightening procline teeth are engaged early in wire progression. Rotating the maxillary occlusal plane clockwise will produce more incisal display and more convex smile arc. If the occlusal plane is flat, the gingival bracket divergence should be increased even farther from the traditional bracket positioning to enhance enamel and gingival display. So this has been advised that if the patient is started with a very flat smile, so we have to create more divergence so that we get more display of incisors and the gums. Smile arc protection positioning effects on the proclination of the upper incisor. This bracket positioning also provide better control. So we know that it provide better torque control. Now it also provide better control of incisor flaring in non-extraction fixed treatment cases. It provide better torque control also, and this bracket positioning has a positive effect because it lowers the effective torque prescription. In crowded non-extraction cases or patients with a pre-existing incisor proclination, smile arc protection bracket positioning has a positive effect because it lowers the effective torque prescription. Upper anterior flaring can be controlled even more by inverting the brackets 180 degree and using 1725 like thick wires in the slot of H4 bracket. So if you invert you can reduce the torque more, and better torque protection, you can see it. So first is in any crowded cases, we don't want more incisors flaring or more torque, okay? And by inverting them, we can retrocline the upper incisors better, and we have a better torque control even only with the bracket positioning and by inverting them. So what are the effects of broad anterior arch form on a smile arc? Arch form that are excessively broad in the anterior region actually flatten the smile arc. So we should not use any wires with a very broad arch form in the anterior section. In the Damon wire, if you see here, it is more narrow from canine to canine and is more broad at the back, giving the appearance, as you see in the picture, that there is more, the buccal corridors are not visible and the upper incisors follow the lower lip, and there is no flat smile arc, okay? And it's because of the tapered anterior aspect of the arch form. So what are the effects of steep canine tips on the smile arc? We have know about it, that when we putting the bracket before that, we have to recontour any sharp cusp, okay? And why we need to recontour? So that when we finish, we don't end up in this type of finishing error. Okay, so the aesthetically shaped canine at a proper inclination are essential for a beautiful smile. A steep and pointed canine tip results in a hanging canine when the contact point between the canine and the lateral incisors is aligned. If the canine tip is aligned with the lateral incisor but the contact point is too gingival, the embrasure will look unsightly. It doesn't look good. And performing a positive or negative coronoplasty like recontouring before the bonding procedure will optimize the aesthetic contour of the canine while still allowing canine disocclusion. So if you can see in this picture A, if the bracket is placed too incisively on steep pointed canine, contact will be very gingival. If the canine tip is aligned with the lateral incisor but the contact point is too gingival, the embrasure will look unsightly. It doesn't look good. And here, if you can see, is the typical hanging canine, okay? And idealized canine contouring has been done here. So this has been recontoured prior to the bonding, okay? Will end up getting a very good finish, okay? And it also allow you to place the bracket in the right position, which is more gingivally, okay? Effects of tooth shape and size discrepancy on bracket positioning. For canines and incisors, we may need to do the positive or negative coronoplasty. Like we may have to grind it or we need to add and restore it. The other way of changing the shape is you can do crown lengthening, okay? So you don't touch the crown, but you can cut the gingiva and increase the crown exposure. The third way is that you add the composite on the incisor edges, which can also can impact on the overall appearance of the tooth. The aesthetic principle of incisor dominance dictates that upper central incisor must be the predominant tooth in the aesthetic smile. So whenever the patient smiles, the incisors should be visible 100%. Okay, this means it must be display the widest actual and visual crown and the widest flat surface for light reflection. It must also be the longest tooth by both actual length and proximately to the idealized lower lip curvature in the pose smile. Smile arc protection bracket positioning facilitate incisor dominance because the divergence of the bracket progression places the incisor, central incisor at the most gingival position of the upper anterior teeth. So this is one of the additional case. We took it from the article, and you can see here that it's a case of 21-year-old female patient with a hypertrophic masseter muscle. So you can see here how the cheeks looks, right? It's a brachyfacial appearance and the very prominent masseter muscle. Class 3 tendency, proclined upper incisor, and reverse curve with smile arc before the treatment. So very flat smile. Okay, so what it giving us the idea that in this patient we may need to use the smile arc bracket positioning technique so that we can create a nice smile arc. Okay, the treatment plan involve extracting the third molar, injecting the botulinum toxin in the masseter muscle 1 month prior to the treatment, performing gingival recontouring and positive coronoplasty with composite resin, placing tag in the upper posterior buccal shaft, and engaging the light short class 3 elastic at the first appointment to distalize the lower arch. So that's how it has been managed. You can see it that brackets has been reversed, and you can see that there is more torque prescription. So by placing such reverse bracket, we can do the retroclination of the upper anterior teeth. After 9 months of the treatment, show the maxillary anterior bracket positioning with the stap bracket positioning and the inverted for the additional crown torque. Okay, you can see it, and you can see there is a space here. Yeah, so it can help for class 3 correction. And after 12 months of the treatment, you can see how it looks. Yep, the teeth are more upright, and after 15 months of treatment and gingival recontouring, you can see a positive smile arc, okay, from the side view and from the front view. Okay, and here you can see the pre and the post pictures, in which the pre picture you can see it was a flat smile, and in the post picture you can see a positive smile arc. Thank you.